Good morning. My name is Alejandro Barrios Cortez, and this is my presentation on memory loss and PTSD severity. These are some members of the Maori tribe. According to Judith Binney, Maori tribe traditions say that the past is seen as that which lies before one, the days in front. It is the wisdom and the experience of their ancestors which they are confronting and seeking to interpret. This quote highlights the importance of memory, even in such a tradition-driven tribe. My research question is, to what extent does trauma-induced memory loss contribute to the severity of PTSD? This question aims to highlight this importance of memory in a specific group of affected individuals. After extensive research, I found the answer to my question to be that trauma-induced memory loss increases PTSD severity due to involuntary memory fragments worsening trauma processing and voluntary memory loss disrupting emotional regulation. Firstly, I found that involuntary memory loss, specifically in memory fragment form, worsens PTSD symptoms. As defined by Atlas City, fragmented memories can appear as sensorial impressions like snapshots of images, sensations, smells, or emotional states experienced by the survivors that lack contextual information such as date, time, or frequency. Since these memories are not broken, the mind struggles to process them, causing a worsening in PTSD symptoms. This is best demonstrated by Vladimir Jovic, where he says that as anxiety related to trauma cannot be mentalized, fragments of the self are split off and evacuated. These experiences remain as fragmented bits and pieces that can express themselves in bodily pain, dissociated states of mind, nightmares, and emotional disturbances. This idea can be expanded on in terms of emotional recovery. According to Vladimir Jovic, in contrast to ordinary memories, both good and bad, which are mutable and dynamically changing over time, traumatic memories are fixed and static. These harsh and frozen imprints do not yield to change, nor do they readily update with current information. In the scope of PTSD, this freezing of memories can be seen as detrimental. If an individual is unable to change how they view memory, they will be unable to change it in the spirit of emotional recovery. Another piece of evidence that I found was involuntary memory loss. We can see an example of voluntary memory loss occurring in a traumatic patient when Atlasity says that she has difficulty talking about these issues and prefers to keep this information hidden. She doesn't remember some of the details about her past and chooses not to remember. Once again, a connection is made to emotion. This time, it's centered around the issues that arise from patients not knowing how to deal with their past memories and trying to forget them. The consequences of these issues are shown in a study by Sydney Timmer Murillo, where she says that difficulty with emotional clarity was associated with hyperarousal and negative alterations in mood and cognition symptom clusters, as well as overall PTSD symptom severity. We can see this again in this table, where we see PTSD symptom severity connected to negative alteration in mood and cognition, as well as hyperarousal. A consequence of these increased symptoms is shown in a study by Kira Farelli, where she says that only trauma-related coping motives were found to mediate the link between greater PTSD symptoms and more frequent cannabis use and cannabis problems. We can see that here in this table, where we see a bold line connecting PTSD symptoms to trauma-related coping motives, and then connecting trauma-related coping motives to cannabis problems. With this being said, some may argue that in contrast to memory loss, the retention of memory can cause PTSD symptom severity. This is shown specifically with flashbacks by Lauren Pathahis, where he says that some research has shown that trauma leads to more involuntary recall rather than less, and involuntary memories, such as flashbacks, are listed in relation to post-traumatic stress disorder in the DSM-5. He also expands on trauma words, one of the usual causes of flashbacks, where he says that those highly dissociated do not show motivated forgetting of trauma words compared to other less threatening words. On the contrary, they remember trauma words all too well. In response to this, I'll argue about the way the memory is presented. By nature, flashbacks contain bits and fragments of memory, meaning they can be classified as memory fragments. From there, I believe that while flashbacks can be triggered by trauma words, it is the fragmented and incomplete nature of the flashback that prevents proper emotional processing, ultimately having a more detrimental impact on recovery than the remembered parts of the memory may have. For my resolution, I would like to highlight a quote from Cornelia Mayron, where she says that overall, Previous studies reported negative links between PTSD symptoms and quality of life. From there, I would like to keep in mind that this is a reality for PTSD patients, and they have to live with these PTSD symptoms for the rest of their lives. My best solution would be to assist the patient with managing their memories in a way that would help decrease their PTSD symptom severity. However, I do understand that there are some limitations to this. For a doctor to be able to correctly treat a patient, they have to deeply understand the patient and their trauma. This is difficult considering that not every patient is the same, and if treated incorrectly, treatment can have the potential to be harmful instead of helpful. Thank you.
All right, 2 questions for you. What information did you need that you weren't able to locate, and how did you deal with that?
I really did struggle to find different graphs or visuals to use in my presentation because a lot of my research was more theoretical, talking about psychological aspects of the brain, and not a lot of information that could be put in a chart or a graph.
Okay, and what additional questions kind of popped up as you were working your way through it?
So there was the additional question of what exactly could be the cause of the PTSD, because a lot of the times it can be something that happens emotionally, not so much as physically, which could change in some sense what the effect of that trauma would have, but it wasn't too much of a difference, so I chose to keep it all as one topic.